My name is Dr. Michael Geraghty. I'm the Chief Surgical Resident here at Waterbury Hospital, one of 2 Chief Surgical Residents here. I graduated from medical school in 2019. First 6 months of 2019 was the interview process, and then I matched in March of 2019, and then I started here in end of June in 2019. Surgery is a very rigorous profession. Residency is very difficult. It's long hours, a lot of time, but there's nothing quite like it. It's very rewarding to see kind of immediate improvement in your patients. You start off as an intern, a first-year surgical resident, working a lot. You're mainly doing a lot of floor work, taking care of the patients after surgery, before surgery, getting them ready for surgery, and then you're getting in an operating room for some smaller cases. And then as the years progress, you get into some larger cases and you're doing a lot more and take a lot more responsibility. In your first 2 years, you're always on call with a more senior colleague who can help you and kind of take you through everything. And then after you become that senior resident in your 3rd and 4th years in the hospital, you're really in charge of taking care of the patients. You always speak to your chief and your attending, but at that point you're really taking a lot of ownership and actually managing patients' care, and you're doing a lot more of kind of the bigger surgeries at that point. That transition from junior resident when your first couple of years into senior resident is a big transition to kind of take over that responsibility of the patient management. And then as you kind of progress and become a chief resident in your 5th year, that's when you take on an administrative role where you're actually overseeing everything else that the junior residents are doing, the senior residents are doing. You're making the schedule, managing the OR, and if there's any issues, a lot of times, doctors, nurses, people will come to you because you have a direct line to, the chair of surgery and the program director and everything like that to try and make sure that things get done and people, continue to work efficiently. I really wanted to come here to Waterbury Hospital because it's a smaller program. We have 2 residents a year, except for in our first year when there's 4 residents. Every other year it's just 2 residents. We have no competing fellows or other surgical residents here in the hospital. So if anything comes to those doors and needs surgery, we help with that. We don't get in as much on the neurosurgery or orthopedic surgery cases, but pretty much anything else that goes to the OR, one of the general surgery residents is there helping. We do a lot of vascular surgery, plastic surgery, ENT. We help out with C-sections. We do a lot of endoscopy work with the GI doctors. I actually do a lot of ERCPs and bigger, more advanced GI procedures myself because I have an interest in that. And the only reason that I can do that is because here at Waterbury Hospital, we have a great relationship with all of our other surgical colleagues and specialists, and there's no other competing residents to, kind of take cases as it were from us. So we get to kind of be hands-on in all of that. I think if you are applying into residency right now and you want to be a general surgeon and you want to be a confident, capable general surgeon, then Waterbury Hospital is a great place for you. If you want to be somebody that can handle just about anything that walks through the door, you have the experience from multiple specialties and you've kind of seen a little bit of everything, then you want to be at Waterbury Hospital, as opposed to some bigger programs where you have a lot of competing fellows and you may be the 3rd person down on a surgery. Here at Waterbury, you are doing the surgery yourself most of the time. It's you and another attending taking care of these things, and that's really kind of the difference between here and a bigger program. And you get all of the numbers and experience you need to go off and be a successful surgeon right after graduation.